Hello, and welcome to the SBDC Tech Second Annual Women Talk Tech Conference Series. I'm Julie Cranston, Director of the SBDC at UCI Beale Applied Innovation, and I'd like to thank you so much for joining us today. Today's webinar is brought to you by the SBDC at UCI Beale Applied Innovation, UCR EPIC SBDC, and Octane Launchpad. The SBDC is funded in part by the U.S. Small Business Administration and the state of California. The SBDC is here to help you start, grow, and succeed in your business by providing no-cost expert consulting and training such as this webinar. A little housekeeping before we begin. Everyone is muted during the webinar. Tomorrow, the recorded webinar and a PDF copy of the slides will be sent to all participants. We will have time for Q&A with our panel at the end of the presentation, but please feel free to ask questions during the webinar by clicking on the Q&A box at the bottom of your screen. Before we get started with our panel discussion, I'd like to welcome our moderator, JC Ruffalo, Director of Octane Launchpad SBDC, who will introduce some of our most important stakeholders to say a few words. JC?
Thank you, Julie. Wonderful, and such an honor to be here today and be the moderator for this. We're going to have a lot of fun. We have three great companies that'll each be presenting for about 10 minutes, followed by about 5 minutes of Q&A from three esteemed investor judges. But before we get to that content, I'd really like to talk and thank all of our stakeholders. And first of all, I'd really like to thank Christopher Lorenzana, who's the Deputy District Director at the U.S. Small Business Administration. So Christopher, if you wouldn't mind just speaking a few words, thank you for your continued support.
Hi, JC, and hi, everyone. Thank you very much again for the invitation to participate in sharing a few words. I just want to say that it's been such a pleasure listening in over the past few weeks during the Women Talk Tech sessions. We have a number of new team members at our office, and this has been one of the first events that they've been able to get plugged into and learn from, and they just have a lot of great feedback about it. So kudos to the entire team for putting this together. Just real quick, SBA is very proud to be able to invest into these types of programs, and we're very proud of the work that the SBDC is doing. These types of things get put together by a lot of partners, including GoBiz with the state of California and local hosts like UCI, UCR, and Octane. These demo days are some of my favorite types of events. And so I'm just looking forward to hearing from the firms that will be presenting, and also hearing some of the questions that the investor judges will ask. I learn every time I'm participating and listening in on an event like this. So once again, the other quick plug I want to put in is for the Small Business Innovation Research, or SBIR and STTR programs. Those are SBA managed programs, and I believe one of our startups today presenting was awarded an SBIR grant last year. So if you are listening in and you don't know much about those programs, I would encourage you to listen intently today and also learn more about the programs and how they can help your startup succeed. Reach out to our SBA office for more information, but just as importantly, get connected with the three small business development centers that make up SBDC Tech. They can absolutely help you along the road to success. So I'll turn it back to JC.
Thank you, Christopher. Wonderful. And thank you for your continued support and everything that the SBA does. So we couldn't do it without you. So thank you so much, Christopher. Next, I'd like to introduce and really thank Isabel Guzman, who's the Director of the Office of Small Business Advocate in the Governor's Office of Business and Economic Development. She really helps support us in our initiative with all three of the tech centers and the rest of the SBDC centers of the Orange County Inland Empire. So Isabel, if you'd like to say a few words as well.
Yes, thank you so much. Appreciate the invitation to be here. I'm excited to join this Tech Talk event. Again, excited to hear from the women innovators that are going to share their pitches today. I think that's what's inspiring to all of us, and it's really what drives our economy. As was said, I'm the California Small Business Advocate, and I operate within GoBiz, which is the Governor's Office of Business and Economic Development. And my office has three main objectives, which is providing you with information and resources, either direct or through shared content with our corporate partners, and most importantly, through this incredible network of 86 centers that we support throughout the state, including the small business development centers and the technology centers at UCI, UCR, Octane. So we are fortunate to have them in our network to help us propel that entrepreneurship and get the information and resources out there. We also serve as your voice, really advocating for you across state government and in the private sector. Governor Newsom feels that small business and entrepreneurship is where we lead and has elevated the office back to a director level position so we can have that cabinet level reach, whether it's on contracting or barriers that you experience. Our office is there as your voice and as your network. And finally, we advance resilience. We lead on the economic recovery support function within the state of California on behalf of GoBiz, really working on response and recovery and helping businesses prepare for disasters. I joined the Newsom administration about a year ago as I was called to the Governor Newsom's vision of this California for all. Really resonates with me is knowing that so many diverse and women-owned businesses are the source of our growth in the future. And so really it's about all of you here today. We know that multicultural and women-owned businesses are going to help us recover in the state of California. There's a Morgan Stanley study that I like to quote, which states that minority and women-owned businesses could produce $6.8 trillion in gross receipts. That's 3 times their current output, if we could help propel them to make sure that they match their percentage of the labor force and their business revenues equal traditional firms. And so these activities today are really what going to help us close that gap. We want you to be prepared. We want you to have the support network behind you so that you can achieve that scale, achieve that growth that we know that you're prepared to do. So if we can empower all of our women businesses to start at the high rates that they're starting and really be propelled within the SBA support networks, our own state support networks, and these incredible networks through the small business development centers, I think we can help achieve and close that gap. So just know that we're here for you in the state of California. We have capital programs, government contracting programs, as well as technical assistance to help serve you. And you can reach us at business.ca.gov or follow us at California OSBA. But we're pleased to be here to support these efforts and support all of you as you continue on your entrepreneurship journeys. Thank you so much.
Thank you, Isabel. Wonderful. And really, again, thank you for all of your support. We're all in this together. Next, I'd really like to welcome Mike Daniel to speak a few words as well. He's the director of the Small Business Development Center here in Orange County in the Inland Empire. Mike, would you mind saying a few words as well?
Yeah, thanks, JC, and welcome. Good afternoon, everybody. Just wanted to welcome you to this event and to many events that we run throughout the Orange County Inland Empire region. And so you have 3 amazing directors right now, and you're going to get a chance to see the work that our tech centers do for our clients. And so if you happen to be a client, we'd love for you to, if you're not, to sign up at one of our tech centers or within one of our traditional SBDC centers. And I'm super excited to see, these 3 female founders talk about their businesses. I've heard a lot about it from JC, Scott, and Julie, and the work that they're doing with them. So I think you're in for a treat as far as how sophisticated these clients are and where they're going. It's awesome to watch. So thank you. I also want to thank Isabel in the state of California and Christopher Lorenzana and Adalberto Quijada from the Small Business Administration for their support in supporting our programs and making sure that we're out there to support small business. So thanks, JC.
My pleasure. Thank you, Mike. Thank you, Isabel. Thank you, Christopher. Again, we can't do this without all of your support. So thank you for being such a huge advocate for all of us. So thank you again to all of our stakeholders. We appreciate your support and partnership. Now, if anyone on this call is interested in getting connected with us, you can contact us. You can see on this slide, you can reach us via phone, via email, or just check out our website. We're happy to help and get involved and point you in the right direction. So we'll transition now into our 3 companies that will be presenting. But before we do that, I'd like to welcome our investor judges, and they can quickly say a few words. Let me start with Mike Benvenuti. Mike, would you mind speaking briefly and giving your name, background, and your fund? A little bit more information on your fund.
Yep, JC, thanks for inviting me today. I've had a chance to pre-screen these 3 deals and review their decks. I'm very impressed with the quality and optimistic that we'll have an opportunity to see them again as they all get into the fundraising stage. Just a bit about the co-fund. I'm one of the 3 managers of the co-fund too. The co-fund is a early stage seed fund headquartered at UCI Beale Applied Innovation. It's a $14.5 million fund, although through our syndication efforts, we plan to raise about $100 million for Southern California-based startups. We're going to invest in 25 startups in the tech and life science sector based here in Southern California unless they're connected to one of the UCs. We typically invest $2 to $3 million in that first tranche with a pre-money of less than 10. If they're truly seed stage, our strategy is seed and feed. We put a seed investment in, and then we feed the ones that are successful over time. Our initial investment for the fund is about $300K. Again, we syndicate another $2 million typically from our LPs and from our partners. And what we're looking for is an inflection point in the valuation based upon that first investment. Of our first 15 investments, we invested in 7 verticals: biotech, cybersecurity, IT services, media and entertainment, med device and equipment, software, and telecom. We're syndicating at 7-1. So to date, we've raised about $40 million for those 15 companies. And well, I'd like to tell you guys that I'm the secret sauce. That's not the case. The secret sauce really is our process and our membership base. We've got 99 members in our fund. That's the max you can have based upon the SEC guidelines. Those members help us source the deals, conduct the diligence, make our investment decisions, and ultimately act as advisors and board members for the companies that we invest in. So again, delighted to be here and hear the story from the 3 female founders today, and hopeful to see them when they get ready to raise funds in the next round.
Thank you, Mike, and thank you for all what you're doing and making more capital prevalent here in Southern California. There's a huge lack of capital here. So excited to see that you are solving that problem. So thank you for being here. Next, let me introduce Minnie. Minnie, would you mind speaking and saying a few words as well?
Sure, absolutely. I'm a partner at 10110. 10110 is an early stage venture fund here in LA. And I really agree with what was said earlier. I was very moved by the introductions earlier here. And I think there's some things about the country that make me worried, but entrepreneurship and innovation here is a real bright spot of our country. And so something I'm very excited to invest into. Maybe sort of similar to Mike, our typical investment, we're investing when someone's raising sort of $1 to $3 million. We like to lead seed rounds at 10110. And before this, I was a female founder of a company called Shift. Started in 2013 and just went public 2 weeks ago. So just very recent. So have just been kind of going through my own entrepreneurial journey. And also spending time, I've actually crossed paths with Isabel in a previous life as well. I'm based here in Southern California, but we invest not exclusively in Southern California, but we have a real focus here. And then I host a podcast, which my side hustle is becoming a big hustle, where I just interview all the VCs in Southern California.
I love it. Thank you, Minnie. Thank you for doing everything that you're doing and helping, lift this ecosystem. So thank you for that. Next up, I'd like to introduce Sandra. And Sandra, would you mind speaking a few words as well on what you're working on?
Yes. I'm so happy to be here. The work that you're doing, all these organizations to propel women in entrepreneurship is vital, and we need it. I am founder and CEO of OC Angel Investors. We are a women's angel investment group based at the UCI Cove. We educate, connect, and inspire women to learn about angel investing. Believe it or not, we are the only group in Orange County, Los Angeles, and the Bay Area that does this. I'm shocked. Founded in 2017, we started with 8 members. We have 35 now, and we look at seed and bridge to A rounds, valuations between 3-10 million. They're usually between $750,000 to $2 million in revenue. Perfect sweet spot for our group. I'm also an LP in the Titan Angel Fund out of Cal State Fullerton. I'm an LP in the Cove Fund too, and I'm a member of TCA. So I'm covering all the bases, diversification within my own. I have 31 companies in my portfolio, and I'm so happy to be here.
Well, we're so happy to have all 3 of you. So thank you, Sandra. Thank you, Minnie. Thank you, Mike, for all taking your time out of your busy schedules to be here today. So next up, we'll transition to our 3 companies, and we'll start one by one. And first up, we'll have Ruijing Zhang, who is the founder and CEO of AVC. She will present for 10 minutes uninterrupted. And then at the end, we'll open it up to our 3 investor judges for about 5 minutes for Q&A. And then following Ruijing's presentation, we'll have Martha and then Layla to close us out. And we should be done right around the hour of 1 o'clock. So next up, I'd like to introduce Ruijing. Again, she is founder and CEO. So we'll give about 20 seconds or so to transition to have her share her screen. Excellent, we can see it. And Beijing recently completed our Launchpad SBDC program and presented at our medical technology conference just a few weeks ago. And out of over 180 applicants that applied, we selected 8. Out of the 8, we had 5 investor judges as well. And she was awarded the Investor Judges Award out of over 180 companies that applied. So we're really, really proud of having a VC as our alumni and going through our Launchpad SBDC program, and excited to have her showcase a VC technologies to all of you. So with that, Beijing, I will turn it over to you.
Thanks so much, JC. And I couldn't have done it without all of your feedback, so thank you. Hi, everyone. My name is Beijing Zhang, and I'm co-founder and CEO of AVZ Technologies. I started the company when I was a student at the University of Pennsylvania because I wanted to make a difference in glaucoma. So I'm excited to tell you a little bit about our progress today and see if anyone would be interested in joining. So this is the Singh Center for Nanotechnology, which is a facility where we manufacture our implants to treat glaucoma. For most of us on this call, we're blessed with good vision, so this is how we see the world. But there are close to 4 million people living in the US today who can't see what you see because they have glaucoma. And once you have glaucoma, this is what your world becomes. Glaucoma affects over 80 million people worldwide and costs the US government over $2 billion annually in direct medical expenditures. At a high level, glaucoma is characterized by elevated intraocular pressure. Essentially, there's this buildup of fluid in your eye, aqueous humor. It normally nourishes your eye tissue and cycles freely throughout the eye. But in eyes with glaucoma, the drainage system is blocked and broken, leading to elevated pressure within the globe that damages the optic nerve and leads to vision loss. There is a rapidly growing market need for better glaucoma surgeries. Our initial indication is to service moderate to severe glaucoma patients, which amounts to over $1.5 billion in opportunity. And this is growing at close to 20% per year as global populations age and physicians seek more permanent solutions for their patients. From there, we may expand our indication to treat mild to moderate patients as well, amounting to over $13 billion in opportunity. Our device is called VisiPlate. It is a novel surgical glaucoma treatment technology, and our tagline is a nanotechnology defense against blindness. We're seeking to achieve durable intraocular pressure reductions with ultra-thin non-fibrotic materials and a short 15-minute outpatient procedure. Our key value drivers are to protect patient vision, reduce complications and costs, and relieve patient backlog. Our device is inserted into the subconjunctival space. That's between the clear layer of tissue in your eye, the conjunctiva, and the thick white tissue, the sclera. The tip of the device sits in the anterior chamber, allowing that pent-up aqueous humor to drain through a network of microchannels. From there, that fluid can be collected on the body of the plate, forming a low and diffuse fluid pocket. Over time, that fluid will be reabsorbed into the body, thereby lowering pressure within the globe and protecting the optic nerve. Now, VisiPlate is the first and only device to use this multi-channel approach to decrease intraocular pressure to a sustainable level. Our microchannel design can also prevent overly low pressure or hypotony, which is a common side effect for some of the current devices on the market today. On top of that, our device is only 20 times thinner than an eyelash. We're able to do this because we leverage a novel patented metamaterial invented at the University of Pennsylvania. The terms of the license are here on the slide. And what's key to note is that we're using highly biocompatible materials with a long history of use in the body, aluminum and perylene C. They're ultra thin with exceptional mechanical properties. For example, if you think of thin materials like saran wrap, you'll quickly notice that they're not easily handleable and they're not freestanding. However, our material can be many, many times thinner than saran wrap and yet recover from sharp deformations, be highly flexible and highly robust. Aside from this composition of matter patent, we have pending US and PCT applications around applicators as well as other devices for treating eye disease using thin films. And we've submitted these applications abroad as well as completed an FTO risk analysis. Zooming out to take a look at current treatments for glaucoma, it's evident that high failure rates abound and that the need for a better solution persists. Patients are usually put on eye drops when they're first diagnosed if they have mild glaucoma. However, these have a very high non-compliance rate due to the hindrance on quality of life. These patients have to take multiple eye drops every hour for every hour of the day. From there, as their disease progresses, patients may get a laser surgery or a golden standard manual surgery. And as you can see from the slide here, these continue to have high failure rates due to scarring down as a result of the surgery. The last line of defense are these implants, which continue to have either high revision rates or, again, a high failure rate because the body responds by scarring down and plugging these drainage devices. This is where Visiplate comes in. We have, using our novel technology as well as a non-fibrotic coating on the technology, we believe we are a better solution positioned to service moderate to severe glaucoma patients. And our preclinical data demonstrates that we have this potential. So diving in quickly here, we use standard preclinical models in rabbits to show that we have biocompatibility and the ability to lower intraocular pressure over time. Now, the FDA threshold is to achieve 20% IOP reduction from baseline. As you can see from the graph here, we're able to far exceed that threshold in our rabbit model, as well as even achieve close to 40% reduction from baseline at some of our best time points. Now, if you compare this data to competitor data around the same stage and in the same model, you'll see that we have a superior magnitude of reduction, 75% greater magnitude of reduction than the Zen gel stent, which was a device that Allergan acquired recently, and 6.5 times longer duration of effect, 1.6 times longer than the Ahmed valve, which is a device known for its safety and efficacy. We also have excellent safety data through a 180-day rabbit study. Visiplate is truly designed to overcome current trade-offs in safety and efficacy that current devices experience. So at a high level, we have devices that are considered very safe and minimally invasive. These are the devices here in the upper left-hand corner of the graph. And these devices are all of the same design, a small single lumen tube about the length and thickness of an eyelash that can be easily injected into the eye. However, not only are they not able to adequately lower intraocular pressure, but they can be occluded within a few months after implantation because of their small single lumen design. Now here in the bottom right-hand corner of the graph, we see a different type of device, the Ahmed valve and the bare belt shunt. These are longstanding incumbents in the field that have good efficacy. They're able to lower intraocular pressure to a lower level. However, their trade-off is that they're highly invasive. If you can imagine, this is a thin tube attached to a drainage plate about the surface area and thickness of a nickel. That's why we designed Visiplate in order to overcome these trade-offs. So Visiplate, again, ultra thin with a surface area to sustain drainage and multi-channel to avoid clogging and provide redundancy. Transitioning to the business model, Visiplate can fall within existing Category 1 CPT codes and achieve payer reimbursement. If we price at par with competitors or even slightly lower, we can achieve over 80% gross profit margins. Our next key milestone is to complete a first-in-human safety and feasibility study in the Dominican Republic. And this study will help support our IDE and 510K pathway here in the United States, ultimately allowing us to achieve 510K in 2023 and enable us to go to market with a strategic partner in the future. On that note, we have been building a strong strategic network within the industry. We currently are being mentored by Johnson & Johnson Surgical Vision and Hoya through various programs such as the Johnson & Johnson J-Labs Incubator and MedTech Innovator Accelerator. We've also spoken to the other companies listed on the slide here, and we'd be happy to work with them should the opportunity arise in the future. In the glaucoma space, there are longstanding precedents of transactions that include commercialization or outright commercialization partnerships or outright acquisition. So for example, the Zen gel stent was acquired by Allergan in 2015, and the terms of the deal are here on the slide. And many of the companies that I mentioned earlier, as you can see, have not had the opportunity to acquire a glaucoma device in their portfolio yet. Quickly, in the time that I have left, I co-founded the company when I was a junior at the University of Pennsylvania. I studied finance and strategic management. My passion for the space stems from time I spent at Allergan and Sanofi working on medical devices. My co-founder, Brennan Cow, and Vice President of R&D, Georgia Griggs, bring nanotechnology and material science expertise. Colonel Colburn and Gary Pruden bring expertise in scaling small startups through the FDA approval and launch phase, as well as launching commercial products globally. We're very lucky to be supported by a stellar scientific advisory board. Dr. Edie Miller-Ellis, for example, from Shea Eye Institute, Dr. Richard Lewis, who's the past president of the American Glaucoma Society, and Dr. Ike Ahmed, who really pioneered the field of minimally invasive glaucoma surgery. In terms of financing, we are closing out a seed round right now, and this was a convertible note. We have $600,000 on the convertible note currently. It's a $5 million valuation cap with a 20% discount to the price of the next round. Sorry, the slide is misspelled. It should be 8% interest on the note. And Looking ahead, once we achieve our clinical milestone showing safety and feasibility, we will be raising a $9 million Series A, and the use of the funds are listed here on the slide, building out our team, as well as funding our US pivotal trial to achieve our 510K pathway. I think my 10 minutes are up, so thank you so much, and I look forward to your questions.
Raging, fabulous and excellent presentation. Really well done. It keeps getting better and better every time I see it. So thank you for that. So next, we'll turn it over to our investor judges for their thoughts and feedback for about the next 5 minutes. Mike, do you mind if I start with you first?
Sure. Raging, that was a very, very good presentation. I've seen more than 1,000 decks and probably 700 presentations. Oftentimes I find that smart founders like you make the simple complex, and you did just the reverse. You made something that's very complex simple, and that will appeal to a lot of investors who don't have domain expertise in your space. So very well done. A couple of questions that I wanted to ask. I'm surprised of the size of your Series A relative to what looks like a pre-seed round. 600K, I know you've received some non-dilutive funds, but 600K really is a pre-seed. Why make that big jump from 600 to 9 million? And have you thought about breaking that into pieces that will allow you to attract maybe some seed funds from the team like me and Xandra, myself, that you run across here in SoCal?
That's an excellent question. And you're right, we did receive SBIR funding. So we received a phase 1 and phase 2 from the National Science Foundation, 1.225 million. And I think that non-dilutive support is able to support us through a lot of value creation activities, such in addition to the seed round, such as doing the first in human clinical trial. And we think once we achieve that milestone, we really will be off to the races, so to speak. We will have excellent data to bring to the FDA, open our pivotal trial here. It's just a 1-year, 50-patient trial, and that will enable us to achieve the 510K. So we've given a lot of thought to this. That being said, our note is not technically closed. So if anyone here would be interested, I would be happy to follow up.
Raging, what's available still on the note?
Around 400K.
So you closed 200 of the 600?
No, so we would raise it to $1 million on these terms.
Okay, so you'd extend the round and oversubscribe.
Yes.
Okay, and then last question is, what are some of the risks along the way from a regulatory standpoint? What are your biggest concerns?
From a regulatory standpoint, we need to show that we have substantial equivalence, meaning we do not raise any safety risks from a material standpoint, and that we can show we are at least as good as devices on the market today. Our technology is a novel material structure. Even though alumina and parylene have been used for many decades, they haven't necessarily been 5 microns in thickness. So a lot of our testing has to be customized to the technological aspects of our device. And we have to make a strong justification to the FDA as to why we can still take the 510K pathway. Now, we have already done an informational meeting with the FDA, so we feel confident that we can go down this route.
Okay, nothing else from me. Very nice job.
Thank you.
Thank you, Mike. Xandra, do you mind if I pass to you next?
Great presentation. I just have to be upfront. This is not my domain expertise, but I do have one question. Is it a one-time solution? So once you have it implanted, it's there for life. And what is the lifetime of the solution?
Yes, the goal is to be a permanent implant. Some devices currently, do again have high failure rates, and in that case, they are not even removed from the eye. Which can cause risks to the patient. But again, because our device is so small and we've actually designed it to be removable should the need arise, we think that we will have an advantage on that front, or differentiation on that front.
Thank you, Xandra. Great question as well. Minnie, do you mind if I turn it over to you?
Sure. Couldn't agree more with what Mike said about just such a clear, useful, well laid out presentation. So thank you. I learned a lot. So I think my question is sort of timeline, but it's both time and money and milestones. And I think you mentioned the 510K clearance in 2023. So does that mean where does revenue start to fall? And that $300 million acquisition from Zen, whoever it was, the stents, is that, paint that timeline for me a little bit better was my question.
Sure, absolutely. So as you can see from the slide here, many of the companies were actually acquired prior to commercialization. For example, the Zengel stent acquired when they were enrolling clinical trial subjects for their pivotal study. This one, the CyPass microstent, acquired 6 months prior to FDA approval. So I think best case scenario, if we show excellent first in human data, we could start having conversations with strategics who have expressed interest. A great scenario would be once we get 510(k) approval, as you can see here, the Express shunt, we would then begin talks to either be acquired or to create a marketing partnership. And that would be some sort of royalty sales and marketing deal. And then a third scenario would be after hitting the first $1 million in sales. So for us, selling around 5,000 units, then we could achieve a milestone such as this, $25 million in commercialization milestone payments to the Zengel stent for their first $1 million in sales.
So that first $1 million in sales is what year approximately?
For us, we can only begin selling the device after 510(k) market clearance. And so that would be, 2024, 2025.
Yeah, that's just a hard, and how much additional capital, like I saw your 9 million Series A, how much do you think, you would need to raise to get to that first million in 2024, 2025?
After the 9 million, it's ostensible that we would go raise another $15 to $20 million in order to build a sales force. But again, we would have to make that decision after we look at the clinical data.
Okay, no, that's helpful. Thank you.
Thank you, Minnie. Want to open it up to the three, any other follow-up questions from the three investor judges by chance?
JC, thank you. This is Mike. Yes, one last question. Raising one slide that might be helpful is if you show a 5-year financial forecast with revenue, expenses, and cash flow at a minimum. Did you not cover, you didn't cover that slide in your deck, did you?
No. This was not in our main deck because I was running out of time. But this is what we believe our revenue ramp could look like with an established sales force.
Yeah. So one quick addition to this, this is a good slide, and you probably should have this in your main deck. I would add some other key metrics to the bottom besides profit, revenue, and share. To answer Minnie's question, you could add one simple line would solve that, and it would be cash flow. That helps,
okay, sounds great.
your judges and more importantly, your future investors understand exactly how much money you need to raise until you get to revenue positive or cash flow break even.
Okay, thank you, Mike. I will work on that.
One simple line.
Great suggestion, Mike. So that will conclude Raijing. Again, Raijing, great presentation. Thank you for presenting today. Thank you to our three investor judges for your feedback. So Raijing, thank you again. We will now transition to our next presenter, Martha Montoya, who is CEO of AgTools. So we'll give her a second to pull up her screen and share her presentation. Excellent. So quick introduction about Martha. Martha has worked with all of our centers at the tech SBDCs here in Orange County, and she also recently presented at Octane's Technology Innovation Forum. And out of over 200 applications, she actually ended up winning the Investor Judges Award at the conference as well, out of the 200. So very excited for AgTools as well, and her future looks very, very bright, as well as Raijing. So thank you. And Martha, do you mind actually swapping your display settings so we can see you in full screen? Right now we're seeing it in kind of presentation type mode.
Presentation mode. So yeah. Let me
go to the top left.
On the top, yeah, on the top left it says display settings. If you just click that.
Here we go. Share.
There we
you should
go.
be seeing full screen. Yes, perfect.
Excellent. So Martha, I will turn it over to you.
Well, good afternoon. Yes, good afternoon. My name is Martha Montoya again, and I'm the founder and CEO of AgTools, real-time market for the agricultural and food supply chain, which is a global challenge, and we have been seeing it on COVID-19. So we go here. The problem. Walk into a supermarket and you will have fruits and vegetables, pork and meat from all over the world. Literally, we now have a whole supply chain that is fragmented across the world. And the challenge is that we have now to have trusted data, not only at the level of the supermarket, but even before at research level and seed level. And that's what we have to address. In the past, and for the generations that have happened, all our farmers and all, when I say farmers and ranchers, have to harvest or have to deal with harvesting the crop without even knowing how the market behaves. They have no idea how it behaves. They don't know what the volumes are, the pricings are. They just go out into what I call the cliff, out into the market. But it's not only the problem of the farmers, it's also the buyers, whether it's the buyer at a Cargill, whether it's a buyer at a Walmart, whether it's a buyer anywhere, they themselves don't have the data, and they're needing the data in order to make better decisions to be able to stock themselves and process. And so what we know is that the food supply chain is completely broken. And so it's very complex and very uncertain. And we need all these actors. We need the brokers, we need the trucking companies, we need the vessels. And they all have the same common denominator, which is very thin razor blade margins. So we decided to come up with a solution, and it's called, we're called the Bloomberg or Reuters of the industry, because we're the dashboard that you can see the data in seconds. So as you will see here, we have over 500 commodities on the tool. We have over 27 years of historical data that moves at 1 billion transactions per second. We have 50 to 60 years of historical data. So our users are able to see patterns and be able to decide how they manage their crops. And we're able also to make sure that we have every single news attached to any of these events that are happening, so they're able to make better decisions. The most important thing here is that there's 76 variables that impact at any time our commodities in the whole world, the supply chain. So we decided that not only we have the data, how we do deliver this in a very simple way, because we're all overwhelmed with data. So we have the mobiles, we have the reports, and even since the last time that we presented here, we already have a couple large companies that have signed on, where they have the data of our market against their own data. So they have on real-time data how the market is behaving and whether they're making or losing money. We made the architecture very flexible, because we knew we were going to deal with many governments, even our own US government data sets that are completely obsolete or out of date. We add our own tool behind the tool, which is the brain that gives all the parameters for all the commodities across the world. If all of you don't know, every single plant and fruit and everybody has nine phenological phases. So it's not just what we harvest, it's before what we plant, the seeds that we put on. That makes the decisions on how we can predict the future in our tool. Here's a good case study. Oxnard, California, the farmer looks at the data, sees how the market is behaving, sees that it's not doing good in New York, send it to Chicago, calls the buyer, and all of a sudden it's $5,600 that not only she's going to make more, but not losing money, which is what they're doing right now. What is the return on a customer from investing $2,400? Those trucks that go up and down the freeways that you see, they're somewhere between $35,000 to $70,000. So the return on investment is really valuable for them. We know the food supply chain in general is a $15 billion in 2019, but what's going to happen is $37 billion worldwide in 2027. And we know that we have all these industries that we can tap. But we have started with the farmers and the buyers, and in between we have been receiving customers that you will see are wonderful to us right now, and they're using our tool. So we have from the large shippers to the associations of berries to the Cargills of the world. We just got the Boston group because they are analyzing carrots. Who would have thought? Because the world is changing. Specialty crops is what we're all eating: fruits, vegetables, nuts, herbs, plants. The plant-based industry is growing, and guess what? Hemp, which happens to be also specialty crop. Who's our competition? Because that's a typical question. Well, we thought we had it, then we have our customers and we survey our customers, and this is where it comes down. It's word of mouth. And even today, when we had a conversation with one of our clients, I don't have time. Somebody will call me and tell me this is the real competition. And then USDA, which now ourselves are starting to consult with them because they have the data completely outdated. So we don't have the competition yet. It's a good thing. sometimes is a bad thing. The milestones, so we launched the capture that you see in there. We launched the plugin for the customers that we're dealing with, like the Doles of the world, of the Food Buys of the world. We have the approval of CPUC, which is giving us more insight in corporate America, like the charters of the world. We fundraised $1.5 million on a seed round. We are now part of Techstars, which is bringing amazing customers and plug and play. It's accelerators that are dedicated to farming. We are now part of Microsoft worldwide distribution centers, and we actually know December 8th, we're a second launch. We already have our first customer through that. And more important, when we fundraised, it was how do we make sure that we have patents? And we brought in IdeaShip company, which is owned by Panasonic, and over 15 engineers and scientists that are helping us put together all our patents and their catalog to file. So we'll be preparing on January 1st to go for Series A. As we grow the business, we need more human beings to manage our companies. So who are we? As myself, I sit on the board of the California Department of Agriculture. I'm blessed, appointed by the governor, and I understand the industry. And I have two wonderful brothers. One is at UCI, Kate Gustavo, who was one of the first engineers for Amazon. He was actually recruited from here to Amazon in Seattle, and builds all the hardware and architectural. And my second brother, which is Oscar, and we always joke, but he sees the world from outside the universe, and that's why our algorithms and our machine learning is so beautiful, because he doesn't see the world from inside, but from outside. We have amazing team members that are super smart and sharp and have been around for 20, 30 years. And our numbers speak to themselves. We have very low churn rate. Actually, we just lost one customer in the last 4 months, and it's only for different reasons of seasonality. And we're growing the business. We stopped going after smaller farmers. We're now going after the large accounts that we're closing as we speak. And what is the exit strategy, or hopefully the partnership, which we're already talking, like with Mr. Richard Cargill, is whether we partner with a Cargill and supply to the customers across the world, or if we sell to a big data company or one of the financial institutions. So we're relevant, we're highly scalable. Definitely the architecture was built specifically not only for specialty crops, which is the most volatile industry in the world, but as we were asked today by Cargill, could we do the pork? Yes, we can do all the pieces of pork. So we're going to go into the contract with them to do the pork systems, establish channel partners, and building our catalog to decide how much we patent, not only here, but overseas, and a highly experienced team. And I thank you so much. We have a wonderful slogan, see more, achieve more. Actus.
Wonderful presentation, Martha. Thank you so much. Great presentation. So let me turn it over to our investor judges, and I'll start in a different way this time. We'll snake back. Minnie, do you mind if I pass it to you first?
Absolutely. Thank you, Martha. Really fun to learn about what you're building. So I'd love to learn more. I understood sort of the high level, the farmers, the buyers, they need more data. You've got these great tool built out. Can you elaborate more on just sort of the use cases that are really driving that? What are they doing with it today? I understood your one case study, but just can you tell me more?
So today with our customer Cargill, who's signing in, we're going into what they call the frontier markets, risk management, meaning that they now can see the data live every 10 seconds. So they're able to decide how they're going to not only manage what they have going on in contracts, but they can see historical and project the future. So they're able to now contract differently. Or you have a farming operation like we have right now, who is the largest blueberry producer in the world. They can see the weather patterns in Poland, in Buenos Aires, Argentina, in Michigan, and they can decide how they're going to supply to a Walmart, because now they can see better the patterns. That's at a high level. At the one farmer that is across the street, he just needs to see what's the pricing today and tomorrow or last week, so they're able to sell to the market across the street. So it has different levels of usage depending on the customer, and we are very aware of that. So we have 4 lanes of sales that we approach on that.
So contracting was one example, sort of supply management was the blueberries, pricing is a different one. And I think your case study was a little bit almost like dispatch or something.
Well, what happened is that there are 23 industries in the supply chain, anyway from the trucking companies to the bank industry to the actual buyer. So the buyer who buys the blueberry, but somebody has to go to the bank. Like we have a farmer that just bought the tool because he's going to go to the bank to get a loan for lettuce. So he wants to know the last 10 years of how the lettuce market has behaved and where it has behaved. So when he asks for the loan, he's not going to overextend himself. On the other side, the bank, which is Citibank in Mexico, they can see how the market is behaving in order for them to be alert to the systems to whether something is going wrong and be able to react to not to the loans. So there are different ways, and it's complex because it's almost like nobody has built it. So we're building it as we go with them.
Yeah, my guess is that you will end up finding that a lot of you'll end up finding there are a few use cases that you really double down on, and you end up that will drive some of your product roadmap to focus in on particular use cases, maybe particular size customers, and that will drive some of your roadmap from a revenue and sort of user need value proposition point of view. But
right, Minnie, and we have to listen to the customers. The one that we just landed, it's a retailer, large retailer, major retailer, and they wanted the use in different forms. So what we did is we created the product that now we can rinse and repeat. So now we can go to the other retailers and sell the same type of service. So we don't have to customize. Or we are a consulting company, but more a rinse and repeat company.
Mm-hmm. Yeah, we sometimes sell our portfolio. They have to turn away business if the business is going to take their product in the direction they don't want to. So
you are very right, Minnie. And we have done that already.
Something of value there. Thank you.
Great questions, Minnie. Thank you. Zandra, do you mind if I pass it to you next?
That would be great. So I have a few questions. How do you reach that customer? You have like many different verticals when it comes to the customer, and just tell me a little bit about that journey.
You saw 23 industries. We're not going after 23 industries, Sandra. We can't. No. We're dedicated right now to 2 industries, farmers and buyers. But what has happened is that being on these programs, Techstars and Plug and Play, they're bringing the other type of customers. So the Boston Group came through one of our incubators and immediately they bought the tool. So we're not actively going after the other 19 industries, but if they're coming, then we manage them, and or we decide not to go with them because it's going to take resources away from us and it's not on the path. We know that the biggest fund money will be coming from the financial institutions. So if it's a financial institution, we will take it. If it's something else, we will hesitate on that. So those are the 2 ways of going. And on farmers, we have a whole machinery going on. We have a million farmers database, and we are doing 1,000 farmers right now. Every week we're doing what they call rinse and repeat, 7 to 15 messages, and we're starting to see the sales 1, 2, 3, 1, 2, 3 per week. But it's every single week to the farmer, talking to the potato farmer, talking to the carrot farmer, talking to the bell pepper farmer, and we're fine tuning with dashboards. What is talking to them? It's the family, it's the money, and it's interesting to see how the team is really becoming a marketing machine to farmers.
So it sounds to me you don't have a clear grip yet on your CAC, your customer acquisition costs, but you're moving towards that, especially using the rinse and repeat model that's working.
We do have it on the 2 sides, on farmers versus retailers. A farmer could be anywhere between 1,500 to 3,000, but a retailer could be anywhere to 5,000 to 10,000, right? Because there are 2 different animals. But we have it somewhere in our Series A. Now that we have more of the history, we're building that out.
Okay, and then let's talk about your revenue model.
The revenue model is for the farmer, $199 per commodity per user per month, and that is automatic. The screens, $2,500 per commodity per month per user. The one that you just saw, which is for the large retailers, $25,000 per user per commodity. And so as you see, there are 3 very variable things, but I I love large accounts because they bring large contracts. So this one that we're signing is a 6-figure contract, and Dole is another 6-figure because they are good customers. And then on this one customer, we started with produce, and now we have a path for the next 2 years to do bakery, seafood, poultry, and so on and so forth.
Great, thank you so much. And I actually know Holly Jackson at Danone Manifesto Ventures. I'm sure you're probably in touch with her, and you should definitely be on their ecosystem.
Thank you. No, don't know, but I will take note.
Yeah, that's it for me.
Thank you, Sandra. Great comments and feedback. Mike, can I pass it to you next? Mike, I'm having audio issues.
How's that?
They're much better.
Might be helpful if I turn my mic on, huh? Martha, good job today. You covered a lot of ground in a very short period of time. It's clear that you've got lots of domain expertise and you have a lot of passion and energy for the space, and that will impress investors in a big way. One of the questions that I had, and Alexandra and Minnie asked most of the important ones already, I'm having a hard time from your deck telling if this is a niche lifestyle business or if this is an investable business for investors like us and then Series A guys and gals beyond us. Tell me a little bit about how big the revenue gets to be in the next 3 to 5 years and what the most important sources of that revenue are going to be in terms of the verticals or the folks in the value chain. That one of the, if you think about your supply chain from the guys who grow the seeds and to the folks who eat the produce, there's going to be some natural stakeholders in that supply chain that are most important from a revenue standpoint. So I want to know, how big does revenue get? How big does the profitability and cash flow get? And what's the source?
When we started the path, it was for to build the architecture to be a food specialty crop, because it will push the technology to be as accurate as possible to a lettuce or a strawberry. But because of that precisely, a Cargill of the world sees this for corn, which with the respect of many people around the world, and they now know, many of the models, financial models, were built around financials, Wall Street. But nobody understood that there's climate changes and there are phenological phases in everything. So that's why the Boston Group will come on board and say, hey, can all of our analysts have this? Our real revenue, Mike, is going to come from hedge funds and from financial institutions. That's where really we're going. So that's the scalable for an investor, to look into that route, not into the farmers and buyers and all that, though that brings the millions of dollars. We are looking at next year, by June 30th, we're supposed to deliver 2 million in sales based on our seed round. We'll be much ahead, and by this December, we'll be on that. And we will be actually on target for the 8 million that we kind of committed for the second year. On target because of the contracts that we're signing. So it is a very scalable business, and I know that because I built businesses around scaling, and because we built this with my brothers, which it was precisely to exit, not to keep it as a business. It's to really exit, whether somebody acquires and uses it or whether we somebody starts managing and take it over. I need to add, Mike, my 2 brothers are part of the 15% of the group of the team members. It's not a business, a family business, which I always have to make sure that I convey that, because this is not a family business. This just happened to 2 of my brothers work there, and they're the people I trust. So we're looking at the 4th year to be a $30 million. We're going to be much ahead of that because of the contracts that we're bringing in.
So Martha, you had all those metrics at the top of your head, which is terrific. One suggestion is that you add one simple slide that has your financial model in it. It's your forecast, and it's it's the next 3 to 5 years. I know that there's always lots of uncertainty at this stage of the game, but investors just need to know how big this can get and how quickly. And all the things you said could have been easily put on one slide and would have answered those questions and probably gotten me and others really excited about the potential.
And I thank you for that, Mike. I just come from the industry where black is black and white is white. And so I have always a hard time trying to tell people what we're going to do, because we have to deliver what we have to deliver in an industry. So I will do that. Thank you for your suggestion. And I feel more comfortable today than 3 months ago because of the context that we're signing. So now I can start blowing it up.
Nice job.
Thank you, Mike.
Nice job.
Thank you, Mike. Thank you, Sandra and Minnie, for your wonderful feedback and comments back to Martha. And Martha, again, wonderful presentation. Thank you for participating today as well and giving the presentation. Next and lastly, and I know we're running a little bit behind schedule here, but next I'd like to introduce our third presenter, Layla Safavi. And Layla, I will turn it over to you once we get your screen up. So if you don't mind sharing your screen.
Great, thank you.
Perfect. So we can see it now. So Layla, I will turn it over to you whenever you're ready.
Great, thank you. Thank you for this valued opportunity. My name is Layla Safavi, and I am CEO and co-founder of Pure Isotope Technology, where our focus is to produce and provide key radioactive ingredients that's used on a daily basis to diagnose and treat life-threatening diseases such as cancer. Would it worry any of you if I said the supply and availability of a key ingredient that, again, is used on a daily basis to treat and diagnose life-threatening diseases is at risk of becoming unavailable due to heavy reliance on unreliable foreign resources? This key ingredient that I'm talking about is the main radioactive component of radiopharmaceuticals. Now I'm going to take a brief step back and go over what a radiopharmaceutical is. So it's composed of two parts: the pharmaceutical part, which localizes in the target tissue or organ to be imaged or treated. And then we have the key radioactive ingredient part, which is the radioisotope that emits radiation that's picked up by the diagnostic device for imaging purposes, or that emitted radiation kills the cancer cells and eventually kills the cancer tumor. And our key focus is just to provide that key radioactive ingredient to radiopharmaceutical manufacturers. So, as you all know, radiopharmaceuticals and radioisotopes aren't anything new. They've been around for a long time, but as highlighted time and time again over this past decade, there has been an issue with the supply and availability of these key ingredients. And that has just been overemphasized, like probably everything else with the whole COVID-19 situation. So, as I mentioned initially, we're heavily reliant on foreign resources. So around 80% of the world's radioisotope supplies are provided by 7 main reactor facilities highlighted here in green. And as you can see, none of them exist in the US. All of these reactors, except the Opal reactor in Australia, is close to their decommissioning age. So similar to the NRU reactor that I'm showing here in Canada, which shut down in 2018, we can anticipate a large number of these reactors going offline without any new ones really coming online to replace them. Another key issue with radioisotopes and anything radioactive is, especially when they're used for medical purposes, they have a shorter time frame, is they start to decay and degrade as soon as they're produced. So they don't have a shelf life, they can't be stored or stockpiled. And you can imagine how highly inefficient it would be to, say, produce radioisotopes at the Safari reactor in South Africa to be able to treat a patient in California. Oftentimes you need to overproduce to compensate for the amount that is going to be lost by the time it reaches the patient. And last but not least, another problem with this whole model is the transportation and regulation issues that we often hear is a problem with transporting and sending radioisotopes across the globe. So why don't we do isotope production in the US? Despite, as you can see in this map, we have over close to 30 research reactors spread out across the country that can produce radioisotopes that can be used for medical applications. We actually do isotope production in the US at the University of Missouri, which does a great job, and a number of the Department of Energy facilities that we have spread out across the country. But the difference between these reactors, which is similar to the foreign reactors that I just went over, is they operate at a much larger capacity and are able to produce with the purity required for medical applications. And similar to anything else that goes into the human body for medical applications, purity is key. So the majority of these reactors that you see here operate at a smaller capacity that cannot provide the purity required for medical grade radioisotope production. And that's where Purist comes in. And before I go over what Purist actually does, I want to bring to your attention that 60% of the US hospitals exist in a state with one or more of these research reactors. So you can imagine how significantly we can decrease the production to patient time with having more of a distributed network of research reactors producing medical grade radioisotope ingredients. So Purist is developing a patented technology that will enable these smaller scale reactors that are otherwise dormant to medical grade radioisotope production, produce radioisotopes with the purity required for medical applications. And we are initially implementing this technology at the university and partnering with the reactor at the University of California, Irvine, right here in Southern California, to implement this process. So it takes advantage of a continuous production process that separates, isolates the radioisotope upon production, enabling us to obtain it in a purity required for medical applications. So among our advantages to the competitors, so there's a lot of up and coming companies working on developing radioisotope production technologies, and mainly that's to decrease our dependence on foreign resources and increase our domestic capabilities. So some of our advantages to what exists as the state of the art and the up and coming new technologies is that we have the ability to leverage existing underutilized nuclear reactors that aren't currently being used for this purpose. So that puts us in a certain significant advantage in terms of we don't need the hefty capital to build new nuclear facilities, which can be upwards of $1 billion or even more, or the hefty regulations required to build these new facilities. In addition to, we can ensure reliability through having access and production at multiple sites throughout the country. So even if one facility goes down, we have multiple other ones that we can work with to ensure there's not a disruption in the supply chain. We have shorter production times on the order of a day compared to what's currently been done, which can be anywhere from a couple of days to a week to even a month production time. We require less energy because we're using these smaller facilities. Again, our production process is less expensive, and that's mainly due to the fact that we're leveraging existing reactor facilities, and both our production process and the facilities we use generate less radioactive waste to what's currently been done. In terms of market opportunity, in 2018, the total available nuclear reactor based radioisotope market globally was at 4.9 billion. And there's two modes of radioisotope production, one using nuclear reactors and one using particle accelerators. We're just focusing on the nuclear reactor produced market. So it's globally at 4.9 billion. The US accounts for 54% of that market, putting it at 2.5 billion. We're initially focusing on a niche underserved market of just the therapeutic radioisotopes, which is increasing significantly in demand. And upon 5 years of production at 10 initial nuclear sites, we anticipate a share of market around 88 million. So in terms of our business model, we have unique precursor targets that we're designing, and we're going to be partnering with research reactors nationwide to implement our production technology to be able to produce and provide these radiopharmaceutical manufacturers with radioisotopes. And from there on, in terms of how it reaches the patient, it will be just business as usual. So we're looking at ourselves as an ingredient change for these radiopharmaceutical manufacturers. Just to give you kind of like a broad overview of where we are. So this technology was developed during my graduate studies at the University of California, Irvine. We filed IP with UCI. We formed Purist, and we also participated in a number of different entrepreneurial programs provided by UCI Beale Applied Innovation. We were awarded a phase 1 SBIR by the National Institutes of Health. We also got a matching SBIR award from Launch Tennessee in the state of Tennessee. We're part of the Innovation Crossroads program at Oak Ridge National Laboratory, which is a DOE funded program, again, providing a number of different resources, including R&D funding. Our patent got granted this year, and currently we're in the process of process optimization with the first pilot site at the UCI nuclear reactor and focusing on expanding our team. Beyond that, we hope to be awarded a phase 2 SBIR, scale up production, certify our production process, engage in strategic partnerships, both with radiopharmaceutical manufacturers and a number of different reactor facilities nationwide, and hopefully that'll result in initial sales. In terms of a team, we have a well-rounded team with the huge background in nuclear reactor operations, isotope production, target development, healthcare, and business and technology development. In addition to the team that you see here, there's a whole army of people behind the scenes that are also helping us. So SBDC has been amazing, Julie, Hannah, and especially Laura, who's my SBDC advisor, and she's been phenomenal in helping me throughout this past over a year now with all Pierce activities. In addition to that, UCI Applied Innovation as well. From day one, they have been part of everything that I've been doing on multiple levels, and I think they're just like family to me. So in addition to this people, there's a whole army of people behind the scenes that help Purist move forward. With that, I would like to sincerely thank you for this opportunity. We're Purist, focusing on producing and providing radioactive ingredients to ensure no medical procedure is ever put on hold due to lack of access to these key ingredients. With that, I would be happy to answer any questions you may have. Thank you.
Thank you, Layla. Fabulous presentation. Really well done. Thank you for that. First up to start us with feedback, Zandra, do you mind if I call upon you first?
Sure, sure. Great presentation. I learned so much in the technology. So from what I understand, it's something that is used in the production through the reactor for the medical use of the isotopes.
Yeah.
And then you're going to basically change the ingredient in the pharmaceutical at the end. Is there any FDA approval because the ingredient will be changed because you're using this process, or any kind of separate approval that's required before they add your isotope into the solution?
Yeah, that's a great question, and that's a question that always comes up. So we're doing a lot of research on this currently and consulting with a lot of different people. So initially we were told that since if we manufacture to the same standards that they're getting it from the current sources, and if it meets those specifications, it's just a GMP certification requirement. As we're looking more into it, there is going to be some FDA regulations and approvals that we need to look into in terms of like a drug master file and all those associated certifications that we will require once we get it to that phase.
Yeah, and that should be, obviously you're probably looking into that now. That's going to be baked into your raise, because that's going to be time and money needed for that. And then maybe case studies, you may have to partner with a drug solution, a pharma solution to get that going. So the roadmap could be longer. Yeah. So who are you working with to kind of get, that's my number one. Again, it's not my domain expertise. However, I know enough to know that could be adding more time to, where this solution could, number one, prove itself, and number two, be of value to an acquirer. So, let's go back to who your customer is. Tell me a little bit about that.
So our customer is going to be the radiopharmaceutical manufacturers, the person that actually gets all these ingredients and compounds it into the ultimate medical form. And those are the companies that we have initiated the conversation with to see what they require initially just to obtain our product, and in partnership with them, what type of regulations we would need to go through for that drug ultimately to be able to be approved. So we're talking to a number of different radiopharmaceutical companies right now for that.
Okay, yeah. A case study would be wonderful to add to your presentation, just so the people that are looking at it will really kind of understand, okay, there's the value. If this gets, when this gets approved, that's the value to the pharmaceutical company and ultimately to the patient. Thank you so much.
That's a great point. Thank you so much.
Yeah, Sandra, excellent points. Thank you. Next, I'll ask Minnie, do you mind if I turn it over to you next?
No. Maybe I'm a broken record. Because I asked this question before, but can you help me understand the timeline in terms of just big milestones in the next couple of years, and sort of where I understand you've got a first pilot site. So, when do you get to revenues and FDA approvals and those sorts of things?
That's a great question. So everything's been a little bit pushed back, as you can imagine, due to this whole COVID situation. But I'm anticipating to finish the R&D and development required work by the end of the phase 2 SBIR. And I'm kind of ballparking that to around 2024, 2025, and get all those studies in. And then hopefully beyond that, we would initially do initial sales. So the initial sales that we are planning is going to be for R&D applications, not any medical applications. And that's just to see how everything works in terms of compounding and all the requirements. And beyond that, we would be looking into actually selling for medical applications. So just to summarize that, I think medical sales would be closer to the end of 2026, 2027.
Great, thanks.
No problem.
Great question, Minnie. Thank you for that. And Mike, I'll turn it over to you next, if that's okay.
Great, thank you, Layla. Very nice job. And again, like Reijing, you took the very complex business and made it very simple. And for people like Xandra and Minnie and myself who aren't domain experts in this space, but still active investors, you make it easy for us to understand and easier for us to follow. So thank you. A question and then some feedback. Tell me more about your go-to-market strategy. Who do you sell to? How do you sell to them? What channels of distribution do you use, et cetera?
So our go-to-market strategies, we would be selling the radioisotope ingredient to radiopharmaceutical manufacturers who would then be compounding it into the medical form of interest. So other channels that we need to work with, and a big component of it is the nuclear reactor facilities that will enable us to be able to use them and do the production there. But we're going to be selling through radiopharmaceutical manufacturers.
Okay. And you'll have direct sales folks that do that?
Yes. So the radiopharmaceutical community is relatively small compared to other medical areas. So we've already started a lot of these conversations with the main companies that we think we will be able to work with in the future. I have a business development analyst who's been doing a lot of these initial connections and seeing who would be ultimately the right person that we would need to work with when we get to that sales point.
Okay. All right, thank you. And then just a couple of pieces of feedback. I know you're always constrained in the amount of time you've got to make your pitch, but there were a couple of key slides that would have made it a lot more helpful for folks without the domain expertise to really understand your deck. Given that this is going to likely have a complex regulatory framework, both because it's medical and nuclear, I'd probably add a slide that talked about the regulatory pathway and constraints so that people could understand exactly what you're facing on that front. You're also missing, I think, a key slide on the revenue model and the financial forecast. Again, investors are trying to sort out, is this a big business? Can it be scaled? And can I get a 20 or 30 or 40x payout? And if it's going to be a $5 million business, they can't do that. If it's a $100 million business, it makes it easier. So seeing that on the slide, like with the other two that we've already talked about, would also be very helpful. And then lastly, I'd probably talk a little bit about in your deck somewhere the go-to-market strategy, how you sell and who you sell to. And I think that can be easily covered on a simple, easy to follow slide. But overall, a very nice job. Again, you're obviously constrained by the amount of time you have to pitch, but you did a really good job.
Thank you so much. That's all great and valuable feedback. I really appreciate it.
Yeah. Thank you, Mike. Go ahead.
One last thought, JC. The co-fund has developed a slide on the financial side that we share with the companies that are pitching to us if they don't have one. And it's super simple. But whenever they've used a slide similar to that, it negates the need for the members or the audience to really dig deep on the financial slide because it's so simple and it's so clear and it's all on one slide. I'll send you a copy of that and you're welcome to share it with the 3 teams today or others if it's helpful.
Thank you, Mike. Yes, we'd love to share that and going forward to even other companies outside. So we'd appreciate that. Thank you, Mike. Thank you, Xandra. And thank you, Minnie, for all of your wonderful feedback. Thank you to all 3 of our companies as well. So Layla, excellent job. Martha, excellent job, as well as Reijing, fabulous job, all 3 of you. So proud of all of you and look forward to such a bright future you all hold. I will turn it over to Julie Cranston for some closing remarks. But again, thank you to all of our partners. Thank you to the companies and the investor judges for participating today, as well as the audience. So thank you. So Julie, I will pass it to you if that's all right.
Sure. Thanks, JC. Thank you again to our fantastic company founders. Those were excellent presentations. And thanks to our investors for joining us for today's webinar. A huge thank you to all the moderators and panelists from the Women Talk Tech panels already this month, in the last 3 weeks. You all made this series a fantastic success and help women founders with your expertise and actionable advice. We hope you can all join us for our upcoming programs as we close out 2020, and join us again next year as we look forward to Women Talk Tech 2021 next fall. Again, you'll receive the recording and slides tomorrow via email. And if you'd like more information on one-on-one consulting for your tech or life science business, please call us at 800-616-7232, or you can go to sbdctech.org/contact, and we'll pair you with a consultant. Thank you again to everyone today. We really appreciate it. Have a great rest of your week.